Hi, everyone. It's Monika Wahi here with some data science career advice for you. So, I made a blog post where I said I could write your peer-reviewed article for $4,000, which is kind of like saying I can sell you a bicycle for $1. It sounds impossibly cheap because typically you will pay between $10,000 and $20,000 to have one of these teams write your peer-reviewed article for you. So, in the blog post, I broke down a typical budget for a consulting project if you use a public health statistics and research consulting company to write your peer-reviewed article for you. Then I explained how using my approach, I eliminated a lot of tasks on the budget. That's my strategy for getting my price down from $10,000 to $20,000 to $4,000. But then I realized that a lot of my LinkedIn Learning learners and other people who follow my accounts are probably trying to apply for those jobs at those public health research consulting companies. Maybe they are even thinking of being managers at one of these companies. So for you, I decided to make this video to provide more detail on what to expect if you are part of one of these teams. And in the process, I'll be able to explain why these teams cost so much. Let's start with an assumption, and that is whenever you do an analysis and write a peer-reviewed paper, certain tasks always need to get done, no matter what. So the consulting team is being hired by a customer company, so the team is serving the customer. That means the team needs some sort of project lead to interface with the customer. Also, the team needs scientific oversight. But then you have to think of all their operational work. There's lots of paperwork involved. IRB applications, data documentation, writing the manuscript, writing emails to set up meetings, lots of organizing of the team. So someone has to do that. And of course, someone needs to be dealing with the data and doing a statistical analysis. So what public health research consulting companies do is split these tasks up into 3 different positions. 1, 2, 3. These are the kinds of positions that you can get if you are willing to prepare yourself with the proper background and apply. Let me go through them with you. Let's take the first batch of tasks, which is leading the project and providing scientific oversight. This role is a lead epidemiologist or lead researcher role. These people almost always have a doctorate, like a PhD or a DRPH, which is why I don't qualify for this job because I don't have one of those. But you will see both men and women in these roles. These roles are expensive. They cost the customer over $100 per hour, and some of them take home salaries that are pretty high. They are at least on par with academia. You can make a serious career out of being a consulting lead epidemiologist on projects. There's usually one lead researcher per project, but they will often want to get outside expertise to weigh in. So they will interface with other researchers at the customer site or with their own consulting group just as part of their job. They deal with the customer at a high level because they only spend a few hours on every project compared to the other 2 roles. Okay, now let's move on to talking about the second role. This is the project coordinator role. This is the role that does most of the work having to do with putting the manuscript together and making the final product. That involves paperwork, writing, and organizing. This is a very typical role for newly graduated MPHs, especially women. Why? Because even though this job requires the most skills and is the most critical to the success of the project, it is seen as like a woman's job, so it is treated with profound disrespect. These are the cheapest people on the project. The customer often pays less than $100 per hour for this role, so you know the people in it make much less. Usually there is one project coordinator per project, but they are expected to adeptly manage multiple projects at a time and somehow succeed at having everything magically come together on all of them. As you can see, this is a hard job with low respect, low pay, and very little protection, especially if you are working on site. So this is seen as a stepping stone job. Rarely does anyone choose to do this job as a career long term. While it's a good job to get experience, the problem is that no one teaches you how to do anything. So if you don't magically already know how to be a project coordinator when you get there, you quickly and spectacularly fail. Okay, let's move to the last role, which is the data intensive role. They normally call this the statistician role, but really this person does a lot of data management as well as statistics. Someone who calls themselves a data scientist could do this role, provided they know their statistics well enough. Most of these people only have a master's degree, but they cost almost the same to the customer as a lead epidemiologist, over $100 per hour. They may be assigned to a project to be the only statistician on it, or there may be a team of statisticians if it's a data-intensive project. And this is the kind of profession that either you like it or you don't. If you like bopping around from project to project, then maybe this job is for you. But if you try it and you don't really like it, it also makes a good stepping stone job as part of a long-term statistical or data science career. Okay, now that you know all about these roles and what they do, let's estimate why it costs so much to have a team like this developing your peer-reviewed manuscript. Let's start with the epidemiologist. This person has few hours overall on the project, but let's make it easy on ourselves and estimate a monthly cost for this person on a long-term, multi-month project. Let's say this person was devoting, on average, 10 hours per month to a project. At a cost of at least $100 per hour to the customer, already we are up to $1,000 per month. And this is a lowball estimate. The cost actually may be higher, especially if the researcher is well known in the field that is the topic of the manuscript. Okay, now remember, the project coordinator does most of the work on the manuscript, so they have a lot of hours. Let's assume for our calculation that they devote 40 hours a month to a project. That would be about one entire work week per month. But depending upon the project, it could easily be more. And remember, these people are undervalued. So let's assume they cost the customer only $75 per hour. Even with lowballing this person's hours and cost, we still end up paying $3,000 per month for their services. Okay, now let's make an estimate for the last role, the statistician role. Now for the statistician, like with the project coordinator, the hours can get high as well. However, the problem with the statistician role is that it is very costly to the customer, almost as costly as the lead epidemiologist. And if you have a very data-intensive project, they could be devoting as many or even more hours than the project coordinator to the project, depending upon the month and the timeline. But let's lowball this estimate and assume 40 hours per month, like the project coordinator. At $100 per hour, this is $4,000 per month for the statistician. So imagine you have a project that will take maybe 4 to 6 months to go from data to manuscript draft. As you can see on the slide, when you add everything up, you could be paying as much as $8,000 per month, or even more depending upon the data intensiveness of the project. At this rate, a 4-month project is already $32,000. Even cutting that in half is high. And think of all the time it takes just to get these people to meetings and to edit a draft and to be on the same page. While you are paying for the expertise and the convenience, you are also really paying through the nose for this team to mess around with meetings and communication and trying to get the statistician and the project coordinator on the same page. You know the drill. Lots and lots of overhead. Which brings me to my point, which is that this kind of setup is fine if you are rich, like the government, or like one of these wealthy research institutes. But if you are a regular person, you don't want to be paying for all these meetings for the statistician to try to explain to the project coordinator what they did with their model so she can write about it and so on. Who wants to pay for all those painful conversations anyway? So I can do the same thing that these research teams do, and I can do it for a lot less. I can do the whole project for $4,000, and it usually takes me about a month at the most. So what's my trick? I do all 3 roles. I basically can just do all of it, so I do that. That way I don't have to have meetings with myself, and you don't have to pay for them. It's just you and me, baby. And I'm transparent. We set up a Dropbox and I share all the files with you. No playing footsie, hide the data games. And if I'm doing something you aren't familiar with, I just teach it to you. That's why having teaching skills and consulting skills in one person is so helpful. I admit one advantage that the public health research consulting companies have that I don't is more than one person working there. Like, I can take your project from data to draft in about a month, but then I can only really do one project at a time. I don't have a lot of bandwidth. And also, you'd be surprised at the amazing number of subjects I know. Just check out my Google Scholar profile page. I'll link you to it in the video description. And if I don't know the subject, you can just teach it to me. That's how I wrote all these other papers. So, what are you waiting for? If you have $4,000 burning a hole in your pocket and you have a burning desire to get your peer-reviewed paper done, email me or connect with me on LinkedIn and we'll schedule a Skype call to meet for a free consultation. I made this video to help you understand why these consulting teams cost so much and how I work with the customer to cut the costs and streamline the research. If you are interested in learning more about these different consulting positions, maybe even trying one of them, you'll want to watch my video that goes more in depth about each role. And if you are thinking of hiring one of these teams, like you work at an organization that contracts with these kinds of teams, you'll want to watch my video on what to look out for when hiring these teams and how to get the best bang for your buck with them. I'll link you to those in the description. I hope this video opened your eyes to some points to ponder in the world of public health research consulting. Thanks for watching.